Hey guys, my name's Sam and welcome to Prep Medic. In this week's video, we're discussing sick call medicine as well as reviewing the Pillbox, Pillbox Plus, and the PillPack by SOARescue. There is a crucial part of tactical medicine or any first aid that is oftentimes left out of this kind of setting, mainly because it's not cool or glamorous. You know, we talk a lot about tourniquets and we talk about wound packing because that's the really high-speed stuff. But the thing that is not talked about quite as much is your sick call medicine. And sick call medicine is basically the police officer, the soldier, the patient that comes to you and says, "My foot hurts, I've got a headache," something like that. And we have to be able to treat those kinds of injuries and those pains. Number one, being able to treat those will make them more combat effective because they'll be able to concentrate on their mission and won't be worried about that headache or flu-like symptoms. The other part of that is, especially for TEMS medics that might not be embedded with these SWAT teams full time, you need to establish trust. And I have really found in my career that being able to treat those small ailments will go a long ways to making you an invaluable resource to that team. And they will look at you completely different if you can whip out a multi-system cold pill and give that to them when they're not feeling it on the range for a training day. So this is really important stuff to discuss, but like I said, it's not super glamorous. In front of you, I have 3 products from SOARescue, so they're Special Operations Aid and Rescue, and you'll recognize them because they make the med mags, which I reviewed earlier on this channel. Now, I do have an affiliate link for them. I'll leave that down below. If you use that to buy any of the products that you see here, it does help support the channel. They're a really good company. They started in training. They do a lot of EMS and tactical medical training out on the East Coast. So if you're interested in any of that, check them out. The 3 products I have in front of you are specifically designed for sick call medicine. So the Pillbox, the Pillbox Plus, and the PillPack. They each have different form factors for different settings depending how you want to store this. And then of course you can take the contents out and put them into something else, whatever fits for you. So we're gonna start with the Pillbox here and go through its contents. There's a lot of stuff in here, so I'm gonna be reading kind of off the back. What's really nice about this is the Pillbox comes in a waterproof case. So this thing is bomb-proof. You can put it just about anywhere and it's not gonna get soaked or ruined in any way, shape, or form. And then this box also has a pressure relief valve. So if you're in the mountains going up or down flying with this, you don't have to worry about this sealed box blowing up or crumpling on you depending on what the pressure changes do. So that's really nice. The front, it just says Pillbox on it, identifies what it is. And then what's really cool is on the back, they have a list of absolutely everything in this, and they don't just list the medication, they list exactly what it's used for. So somebody that has absolutely 0 training can pick this up and take whatever they need from the box and use it. So I really like that. It does have a carabiner on the side, and it does have a way to tag this if you absolutely need to. So just opens with a closure there, and then on the inside, you see all the medications it comes with. And really, I think this encompasses just about everything you need in this realm. There are like one thing I would add, which we'll get to a little bit later, but pretty all-encompassing if you ask me. So the first thing in here is you have your acetaminophen. So this is just your Tylenol for aches and pains. And then next to that, you have ibuprofen for the same thing. Now, ibuprofen is an NSAID. This is a non-steroidal anti-inflammatory. The reason you would pick one over the other, number one, you can use both of these together. They don't interact with each other. So if somebody's just sick, you can start giving somebody some Tylenol in an hour, and then you can stagger that with the ibuprofen so that you can always have something on board. It's not great long-term because, you know, this is pretty hard on your liver, and these guys are pretty hard on your stomach. They can give you ulcers, especially if you're not eating. However, what the other part of this is that you do not want to be giving an NSAID to somebody that's going into a dangerous environment where they are at risk for bleeding. So getting shot, cut, stabbed, you know, somebody going into a mission, mainly because these will slightly increase that bleeding. The one thing that's missing from here, I think, is aspirin. So you never want to give aspirin to somebody. Really, it's not a great general pain medication, but you never want to give it to somebody that's going to go into the mission for the same reason, because it makes your platelets a little bit more slippery and it can increase that bleeding. But right here, you have these two. I would carry aspirin just because it can be used in chest pain. Granted, a bunch of SWAT officers probably aren't going to need that. But it would be a good thing to have in here just in case. So you have these two for pain. The next item in this kit is Difen. So Difen is a trade name for diphenhydramine, which is also known as Benadryl. Now this is an antihistamine that's really great for controlling some itchiness from hives, minor allergic reactions, and then it can also be used as a sleep aid. So this is a very versatile med. It's something you should really carry in any medication kit you have. I've had a lot of people ask me if this works in an anaphylactic reaction, so those life-threatening allergic reactions. That's kind of a complicated answer. In our protocols, we do give it in anaphylactic reactions. However, this is not going to save somebody's life. So really the mainstay of treatment in anaphylaxis is going to be your epinephrine administration, because that helps with vasoconstriction, bronchodilation, and helps fix some of the cell wall permeability issues. And this is really for more of the comfort aspect of that. That being said, if this is all you have and you're in the wilderness, this is much better than nothing. So I wouldn't hold off on this if somebody is having an anaphylactic reaction. It's just not the mainstay of treatment. So you've got a lot of these in here, and these are 25 milligrams each. The general dose is going to be between 25 and 50 milligrams for patients. Just be aware that with this, it can make somebody very drowsy. So if somebody's going to be up for a long period of time and they're not sure how they react to this, just use it with caution, because it can make them a little bit sleepy there. It knocks me right out. Coming down the line, we have your bismuth. So bismuth is the active ingredient in Pepto-Bismol. It's mainly for nausea and an upset stomach. Pretty much a comfort measure for patients. That being said, diarrhea and nausea leave your patients up to an extreme risk of dehydration, especially in a wilderness or an austere environment. So these are great things to stop way ahead of time, and these can help with it. Generally speaking though, these aren't the most powerful antiemetics or antidiarrheals on the planet. It's mainly just for comfort. So another good thing to have in here. Next to that, we have the Diamode, or the loperamide. So this is a pretty powerful antidiarrheal. And like I just said, stopping the diarrhea might sound like it's kind of a minor thing. However, in a wilderness environment, diarrhea can kill you pretty quickly because that dehydrates you very, very fast. So getting that stopped is very important, and you have a number of those in here. In the same realm of medications, we have the meclizine here, which is a more powerful antiemetic, so it stops you from vomiting. Like I said, the same with the diarrhea, it keeps you from getting too dehydrated. And both this and the Diamode that we just showed you, that is a little bit more specific from the Pepto-Bismol and is a little bit more effective in their given properties. So this is mainly for your nausea and your vomiting and potentially motion sickness. Now, kind of moving out of the pill realm and into some of the creams, minor wound care, we've got a couple things in here. So we have 3 different creams this comes with. So one is hydrocortisone cream. This is for itching, swelling, redness. Isn't gonna save anybody's life, but for somebody that comes in contact with a little bit of poison ivy or has a rash somewhere, hydrocortisone is great. We have first aid burn cream. This isn't for your major burns. This is for, I burned my finger on a campfire or, touched a hot suppressor on my rifle. It's just something that kind of helps keep it clean and keep it cool, so you can put that on a Band-Aid or whatever you're wrapping with. And then last but not least, we have a triple antibiotic ointment. Shouldn't just be using antibiotic ointments willy-nilly, but once again, preventing infection in an austere environment is very important, because it's a lot easier to prevent than it is to treat once it starts getting worse. So all 3 of those are in here. And then next to that, we just have some Band-Aids, which are great for small wound care, some eye drops here, and these are just saline eye drops, really great to have to get contacts out, wet the eye a little bit if they have something in it. It's not really an eye rinse, so it's not gonna work great for getting a substance out, but just to keep somebody's eyes hydrated. There are some cough drops in here, and these are just Hall's cough drops in another little baggie. And behind here, we have 2 electrolyte mixes. So if somebody is exerting themselves, even if they're drinking a lot of water, we have to make sure they have a lot of electrolytes on board. And this is a vital part of hydration for patients. So really something that's needed where there's a lot of exertion, which I don't know a single aspect of austere medicine or austere operations that don't involve a lot of work by the people doing them. So really great thing to have in here. And then behind all of that, there's just some moleskin. So moleskin is for your blister care. You can do it a number of different ways. You can cut a donut, put it around it. You can put it straight over it. That's generally what I do, even though it damages a little bit coming off. But once again, something for that comfort measure. You know, you have a search and rescue team member starts developing a blister, get that early because it's actually going to affect their ability to do their job down the road. So that's everything that comes in the pill box in and of itself. So it's a pretty compact box. It's really not like shoved in here, so it's pretty easy to take something out, put something back in, reorganize it as you see fit. And it definitely has room for aspirin or some other little odds and ends you want to put in if you want to put in a nail clipper or something like that. So pretty compact thing, and this is really good not just for tactical medicine, austere medicine, anything like that. This is great for the weekend adventure. If you're overlanding with a Jeep or something else, put one of these in there. This will make a world of difference for you. So everything that's in here is basically repeated in the PillPack. So this is a med mag. You don't have the rehydration electrolyte sticks, but it does have a lot of Band-Aids. All of the medications that were in here are in here, and this is just a different form factor. So obviously you don't have the really heavy plastic case, and this is more for, you know, if you need something lightweight to throw in your pack. I'd recommend this for backpackers, anything like that. And then of course it does come in the MedMag form factor, which means that I can throw this in any kind of AR magazine platform. They originally designed these because a lot of tactical medics, TEMS medics, were issued big vests, and they had the kangaroo pouch on the front that had mag holsters, and they were not armed contingents. So they would just take these med mags and they could put them directly in those mag holsters and actually make use of some of the storage on their vests, which is kind of a cool idea. So this can definitely be used as such, but this is a small enough form factor that you could throw this in the dash of your vehicle. You could put this in a backpack, anything like that. The Hill People Gear backpack that you guys saw a couple weeks back, this fits perfectly in the outside pocket of that. So a bunch of different places you can put this, and like I said, these basically have the same 2 things. You can actually get a refill for this. So if you go through all the meds or if everything expires, you can go on SOARescue's website and just order a refill pack. It's actually pretty cheap, and get all of the medications for this sent to you again. So that brings me to the last aspect of this, and that's the PillPack Plus, or the Pillbox Plus. So obviously this is quite a lot bigger than the Pillbox or this guy here, and this does not contain everything that these do. This is a supplement to them. So obviously this is probably not something you're going to be throwing in your backpack. It's pretty heavy. But you could put this in your car, you could put this in a bug out bag, something like that for your more minor ailments. Once again, just like this guy here, it's a pretty high quality waterproof case. On the front, it just tells you what it is, Pillbox Plus, and then on the back, it gives you what is in here and what it does. So on the outside of this, you have some hand sanitizer, which in today's day and age, that's a great thing to have. And it's something that was in short supply for a while. So good thing to have here. This one opens with 2 small tabs on the front. You just open it up, and then on the inside, it's actually got a couple bigger items in here. So to start out with, you have some Gold Bond. You might laugh, but chafing is a very real issue, especially if you're hiking for long distances. I'm sure anybody that's been deployed knows why this is a great idea. I've heard some stories. So you've got Gold Bond in there for the chafing, the uncomfortable rubs, anything like that. Have some Kleenex, which once again, don't really have to explain why that's such a good thing to have. Next to all of that, we have a nose spray, some Afrin, and this is just a nasal decongestant. It's a little bit quicker acting than any of the pills, so your diphenhydramine, anything like that. So you do have that in here. That brings me to one other thing I would really like to see in the pill box is some kind of long-term decongestant or allergy pill like Claritin, just because that I don't like taking diphenhydramine, so I'll probably add some Claritin or some Zyrtec in there, but that is something I'd like to see. So the Afrin's a good thing to have. And then next to that, we have some earplugs. So one, it's great if you go to the range and you forgot your ear pro, you've got something here you can use. Number two, if you're camping, sleeping in a tent, sleeping in your car, vehicle, whatever it is, and the guy next to you is snoring, great thing to have. Keeps you sane, gets you a good night's sleep. You got some Q-tips, lip balm with some sunscreen in it, glucose paste. So for your conscious diabetics that are going a little bit low in their sugar, you can use this as glucose paste. It's basically an energy gel. So with this can also be used for your long hikes. Your ultramarathon runners, marathon runners will use these in the middle of the run to kind of give them some nutrients to keep them going, just some pure calories in this. I do not believe this one has any caffeine in it, but you can get these with caffeine as well, and then they work for your conscious diabetics that go just a little bit low. Coming down in the kit, we have some Cryoderm. So this is basically just an off-brand Icy Hot. It's used to relieve some nerve pain. It has, I believe, some lidocaine in it to help kind of penetrate down to the nerves. So somebody that has some severe back pain, cramps, anything like that, you can rub this on them. They'll smell kind of nasty for a while, but it will help relieve that pain. And you've got 3 packets of that gel in here. And then even farther down, we have some poison ivy wipes. So when you get poison ivy on you, it spreads an oil to you. And as you touch that, you touch something else, your face, God forbid, other things, you can start getting that rash everywhere else. And that these wipes will both slow that reaction and they'll get that oil off your skin and neutralize it. So super great to have. I react super bad to poison ivy, which is less of an issue out here in Colorado, but is definitely a big deal in the Midwest where I'm from. Have some Stinger, just it's basically a wipe for pain relief if you get stung by something. And then in here we have a couple things of sunscreen, which are great to have. It's not going to replace a bottle of sunscreen if you need them, but this is for the crap, I forgot my bottle of sunscreen. I can use these for a day or for a hike or whatever it is. And then we have some insect repellent towelettes. This is great for those times you're going to be outside for a long period of time and you don't really realize how many bugs are out until it's way too late. And at the bottom, we start getting into some of our wound closure items. So we have a couple different sizes of steri strips in here. Steri strips are used in lieu of sutures. They're just placed on either side of a large laceration and you can pull them to kind of bring that laceration together. They can sometimes be used as a replacement for stitches. Generally, these are kind of a temporary thing until you can get them to a hospital because they're not going to be on for the amount of time you need them to really heal that wound. That being said, you can do it. I've done it. So it's something you can use and it's a great thing to have in any first aid kit. And then last but not least, we have popsicle sticks. And these are not to make your own popsicles in the wilderness. These are to splint your small extremities, so your fingers, toes, whatever it is. You can just break these off however you need them and then wrap them on the finger. It makes a great splint, very comfortable there. So that's everything that is in this box. Like I said, it basically supplements everything in these guys here. So it doesn't have your over-the-counter meds. It's more of your comfort things, some diabetic stuff, some different allergy things. But this is really great for your kind of wilderness situations. I'd say that this kit for me would be that kit that I would keep in our the Bearcat, or I'd keep it in a vehicle of some kind. It's a little bit heavy for me to be carrying around on my persons in a backpack, anything like that, but you definitely could if you needed to. So these three are kind of innovative kits there. You can get the components online, you can get the boxes from SOARescue, you can get basically any combination of these if you want. You can't customize individually what's in each of these, but there are some options for you. Like I said, I've got a link down below that can get you some money off, and it helps support the channel. Use that if you want, don't if you don't. The one thing I really want you to take away from this video is that sick call medicine is super important. It's something that you really need to be thinking about, whether you're a hobbyist going out for a hike, or if you're somebody in a military medic role, or if you're somebody in a law enforcement medic role. These are things that we take for granted because they seem minor, but they can make a huge difference. They make people more comfortable, better to do their job, and then they also build a lot of trust with your teammates. So really great things to have. If you have any questions, please leave them in the comments down below, and I will see you next week.